Okay, great. So welcome everyone. Hello? Great.
Hi.
Welcome everybody. I'm really pleased to welcome you. I'd just like to ask everyone to put their microphones on mute. And so then we will get started. So hello and bonjour. My name is Caroline Ford. I'm the director of Canada's International Development Research Centre, the Democratic and Inclusive Governance Division. IDRC is part of Canada's foreign affairs and development efforts. We champion and fund research and innovation within and alongside developing regions to drive global change. Now I'm speaking to you from Ottawa, which is on traditional unceded Anishinaabe land in Canada. And the reason why it's important for us now to be acknowledging whose land we're on is because Canada is coming to grips with its colonial legacy. And each of us personally are now becoming more aware and more engaged in terms of what our own history is with colonialism and with the colonial take of land that happened in our history. So it's important for us that we acknowledge that, and I'm thinking about which land each of you is speaking from and whose traditional land it is. Now, achieving gender equality is a long-standing core focus of IDRC, and we strive for equality in all aspects of our work. We support the generation of knowledge, including by individuals from diverse genders, communities, histories, experiences, that tackles the symptoms and the systems that perpetuate the inequality and the basis of identity. So the COVID-19 pandemic has reaffirmed those commitments for us with sharp urgency. And over the last 18 months, a clear body of evidence has emerged to demonstrate the differing impacts of COVID on women, girls, boys, men, and non-binary genders. What has become increasingly evident is the importance of locating gender impacts of the pandemic within a broader landscape of structural, intersecting, social, and economic inequalities. Now, in the early days of the pandemic, IDRC recognized the need to understand and eventually address the socioeconomic impacts of the pandemic at a moment when so much remained uncertain. The session today, which I am delighted and honored to be asked to chair, draws on the research from 3 multi-country research projects from the COVID-19 Responses for Equity, and the acronym is CORE, Rapid Research Initiative. CORE is a 3-year $25 million Canadian that brings together 21 research projects to understand the socioeconomic impacts of the pandemic, improve existing responses, and generate better policy options for recovery. Now, as we speak, the research is taking place across 42 countries in Africa, Asia, Latin America, and the Middle East. The Institute for Development Studies, UK, is providing knowledge translation support to the initiative, and we extend our heartfelt thanks to them for coordinating today's amazing panel. This panel discussion will delve into the evidence generated by the CORE Research Initiative, and speakers will explore the impact of the pandemic is having across the most vulnerable groups, how gender intersects and often exacerbates these effects, and what recommendations for future policy responses have emerged. The panel is very timely indeed, as many regions of the world appear to be ready to move on, in quotation marks, from the pandemic. Important questions remain as to whether, as a global community, have we really truly captured the lessons on gender inequalities that the pandemic has laid bare and exacerbated? More urgently, are we moving on from the aspirations and the intentions early in the pandemic to seize this as a once-in-a-lifetime opportunity for gender transformation? And is all that wonderful goodwill to truly build forward better at risk of slipping away? So the format today is a moderated panel discussion. Panelists will keep their responses targeted and on point so that the format will be agile. We have half an hour set aside following the panel to draw you in, ask questions, share your own experiences and suggestions. So just as a few housekeeping points, as this is a Zoom webinar, you're all familiar with this now after 2 years of working on Zoom. Participants are muted, but are encouraged to add their questions to the chat, which we will read and we will bring them in. And the session is available in English and French. So to switch languages, make sure you use the translation button on your Zoom controls. And there you will see it right there, and make sure you do select one. So let me introduce to you our distinguished panel, and it is my honor to even be in the same screen. I was going to say in the same room, but of course we're not in a room now, we're in a virtual room, but to be in the same screen as these amazing women and amazing researchers. Pranita Achit works as the Director of Research and Programs at ICRW Asia. She has 20 years of experience of applied research and program mentoring, particularly on gender and gender-based violence. Pranita, can you wave so that we can all see? There she is. Okay. Sneha Sharma works as a technical specialist at ICRW Asia. She brings her expertise in conducting gender transformative research for women's economic empowerment and livelihoods. She's currently anchoring ICRW Asia's Rebuild and Women in Informal Economy project. Sneha, are you waving? There she is. Gita Ismail is a statistician and researcher working on leveraging data and statistics to optimize policymaking. She worked as a study specialist in WIGO's Global Crisis Study. And there she is. And Ana Carolina Ogando is a research associate for WIGO's Urban Policies Program, specializing in gender and qualitative and participatory methodologies. She's been the gender and qualitative data advisor for WIGO's Global Crisis Study. And Ségolène, yeah, thank you. And Ségolène Aibi is a statistician, economist, and the lead researcher for the African School of Economics COVID-19 study in Benin. Ségolène, can you give us a wave? There she is. Great. Okay. Now, so I'm going to ask you a few questions each. And we're going to try as much as we can to make this as interactive in terms of being able to join each other from different parts of the world. And I'm going to start with you, Sneha. Sneha, your work has been assessing the impact of COVID-19 policy responses on informal workers in the National Capital Region of India, and in particular to help understand more about the crucial areas of vulnerability for women workers. Can you tell us a little bit about the context and how did you approach this research?
Thanks, Carolyn. I think a very important point in terms of, understanding the context, it was very important for us to understand what were some of the pre-existing vulnerabilities of this group of workers. So in terms of context, in India, we have around 80% of the workforce is part of the informal economy. That means that they do not have access to any kind of social security benefits. And for female urban workforce, that number stands at 87%. Now, most of these, and in fact, in Delhi, this is the kind of cohort that you would find, and there is a large presence of informal workers even in Delhi, and most of the in the National Capital Region, and most of these informal workers in urban areas that are coming, they are migrants from the rural parts of India. They are coming here in terms of better job opportunities. And this kind of informality from their work also seeps into other aspects of their lives. So you would find them living in informal settlements in cramped areas, middle of the cities, without access to any kind of basic services that would be sanitation or water or healthcare services or children's education. So they also live in informal conditions in the cities. Most of these workers were already living on subsistence wages. And COVID just, further exposed their linkages between economic precarity and some of the social vulnerabilities that exist. In terms of the policy making in India, the focus has largely been on rural India. And even in terms of the COVID-19 fiscal response, a large chunk went for rural India. Even in case where there were schemes available for women workers in the urban areas, they didn't have access to these schemes because of existing digital divide in case the schemes were implemented through a digital medium, or they also lack identification documents or any kind of basic documentations of residence proof in these areas. So there was that kind of existing vulnerabilities also. So our approach has been to understand what has been some of the gendered impacts of the policies that were implemented during COVID, and also trying to establish how has the the pandemic rendered them more socially and economically vulnerable, and how to look forward towards a more gender responsive recovery by looking at some recommendations by addressing these vulnerabilities. So that has largely been our approach towards the study.
That's fascinating. Now, Gita, can I bring you in at this point? Similarly, your research is focused on the impact of COVID-19 on informal women workers across 12 cities. So from your data, what can you tell us about the effects COVID-19 has had on women's ability to work and the impacts on earnings? And has this varied between sectors?
Yeah, sure. So before I dive into the findings, I'm just going to give a quick overview about the study. So at the onset of the pandemic, WeGo, in collaboration with member-based workers' organizations across the 12 cities, conducted a mixed method longitudinal study to understand the impact of the pandemic on informal workers in the first 3 months of the pandemic, and then 18 months after the onset of the pandemic, so in mid-2021. The findings that I'm going to present are based on a subsample from the study, which cover almost 2,000 workers, and the subsample includes women, home-based workers, and domestic workers, and then women and men, street vendors, and waste pickers. So basically, we find that the pandemic had adverse impacts on workers across these 4 sectors, and that women were especially hit hard as a result of different city-level restrictions, and then particularly vulnerable work conditions even before the pandemic, and then gendered norms and expectations. So more specifically, we find that home-based workers who were women in our sample were the hardest hit between the 4 sectors by mid-2021, and they had only recovered 2% of their pre-pandemic earnings at the median. This was mainly due to different pandemic disruptions of local and global supply chains. And then domestic workers who were also women in our subsample, among those that were able to work, they were still earning less than 3/4 of their pre-pandemic earnings by mid-2021, and then 16% were unable to work completely. Also, among those that were able to work, they report that they had deteriorating work conditions, which include less pay and longer working hours. And then among waste pickers and street vendors who were more gender balanced, we find that the pandemic had especially adverse economic repercussions on women when compared to their men counterparts by mid-2021. So we note that earnings among women waste pickers had recovered to 67% of their pre-COVID pandemic by mid-2021, compared to 92% for men waste pickers. Also, women waste pickers reported greater difficulty in accessing waste due to competition and then physical labor. Also, similarly, earnings among women street vendors recovered to 55% of their pre-COVID earnings by mid-2021, compared to 70% for men street vendors. We also find that women street vendors were more likely than their men counterparts to report that the lack of capital constrained their ability to work in mid-2021. Thank you.
That's very interesting. And let me bring in Ségolène at this point, because Ségolène, your research spans 3 countries, Benin, Burkina Faso, and South Africa, examining the effects of COVID-19 examining the effects of COVID-19 containment measures. Can you outline some of the key differences between the countries in your findings? You're on mute, Ségolène.
Okay, sorry. Thank you. In Benin, we analyzed how the COVID-19 containment measure have affected intimate partner violence. We use a national survey on about 1,200 households. but we find no effect on of COVID-19 on intimate partner violence. But we find that intimate partner violence have increased among the people among households who experience a loss of income due to COVID-19. In Burkina Faso, the study analyzed how COVID-19 containment measures have differently affect female and male in the informal sector. And we use a mixed method of both quantitative and qualitative survey. The results show that COVID-19 containment measure increase inequality between men, women, and youth in the informal sector. And the youth people are hit harder than adults in terms of turnover. Also, unemployment increased, and women were the most affected than men by temporary closure of films and production shutdown. However, compared to male entrepreneurs, women-led firms were the least likely to use layoff or decrease in wage as coping strategy in this crisis. Now, finally, in South Africa, we analyzed the effect of COVID-19 on different categories of marginalized groups, including the gender-based violence survivors and the LGBTQ plus community. This was assessed through a qualitative survey conducted in 2 townships, Diepsloot and Alexandra. And the results show an increase in generalized global form of violence. And gender-based violence increased during COVID-19 due to the hard lockdown and families having to continuously share compact space for extended period of time. The LGBTQ community was most especially affected as they were experiencing family displacement and loss of housing. In fact, they were in need of alternative housing due to abuse within the family associated with the rejection of their sexuality and intimate partner violence for those in cohabitation. But they could not benefit easily from institutional support or help of the South African Police Service, and therefore they could only rely on the social network for accommodation during the hard lockdown. So that's it for the 3 countries.
Let me continue with you, Ségolène, because it's very interesting in terms of the research in South Africa in particular drew out the disproportionate impact that the lockdown orders had on the LGBTQI community. Can you tell us more about those knock-on effects?
In fact, the LGBTQ survivors are still displaced from their homes. In addition, they did not report to the police because the police service is typically unreliable for handling the situation. So they just refer to the social network for LGBTQ through which they were supported. So that's briefly some how they will show.
And Anna, another key area that's come through really strongly in the emerging evidence is the impact of unpaid care work in livelihood security. Can you expand on this issue and tell us what your studies found?
Thank you, Caroline, for the important question. So 2 years into the pandemic, we're seeing informal workers have continued to cope with care burdens, and reports of increases in direct care responsibilities related to childcare, care for the sick or elderly were actually higher in cities with stronger COVID-19 waves or stricter lockdowns, including Bangkok, Mexico City, Lima, Tirupur, and Delhi. Our findings show that by mid-2021, unpaid care work is directly impacting women informal workers' paid work. And this is reflected in the fact that more than a third of women and less than a quarter of men reported that at least one care responsibility had reduced their ability to work or reduced their work hours. Another way of looking at this is that women reporting direct care responsibilities were working on average 3 days less than they were pre-COVID. We also saw how women of reproductive age were especially likely to report the impacts of care on the ability to work. And interestingly enough, a quarter of older women beyond their reproductive age were also likely to report that care increases limited their ability to work. And this shows how they're not simply receivers of care, but in fact, providers of care. I just want to shift gears now and bring in some findings from our semi-structured interviews with workers and worker leaders. This is really important to share because we saw how women were emphasizing the interlinked impacts of loss of livelihood, more pronounced food insecurity, increased difficulties to cover household expenditures, and much greater concerns over the costs of online homeschooling. So ultimately, all of these issues strongly factored into women informal workers' reports of exhaustion and mental health strains. So I think now if we consider the policy implications of these findings, we see how investments in care infrastructure and public services related to childcare, elderly care, and healthcare are really essential for economic recovery from the bottom up for women informal workers. And the reason here is twofold. First, these investments would imply in a fairer redistribution of unpaid care work. And second, and especially important, it would ensure that women informal workers of all ages can invest time for productive work. So without gender-sensitive policies that account for the direct linkages between impacts of women's unpaid care work on women's paid work, there'll be a much slower possibility for women informal workers to reestablish or recover their livelihoods. And I think I'd be really interested in hearing from Pranita if this is something she's also finding in their study, and if she can share some of the impacts on women street vendors and domestic workers.
Thanks, Anna. Very interesting and lot of points that you touched and very similar, yet there are some distinction. What we found in our study, formative research, we are still waiting for our main primary research to complete. But in the formative research, this was a very common narrative that emerged from almost 3/4 of women we talked to, who explicitly mentioned about increased burden of unpaid care work. And the interesting was the first, it was much more sudden and pronounced when there was the intense countrywide lockdown that had happened. So it was not so much about the infection at that point, but the policy decision that were taken at that time to totally close down the whole country. And that was something everyone felt, that just sheer presence of men, children, everyone within the household throughout the day had tremendously increased the demand on women's time to take care of every need of theirs. So like small, big, cooking, everything that was in a way burdened on them. Children's study, caring for sick. In fact, given the population or the group that we are talking about, women workers who are working in informal, they had to spend a lot of time and energy in just being in queue to get ration, to get the schemes. So there were so many things that they had to manage. But what was even more taxing on them was the taking care of the emotional need of everybody. So everyone, if husband is frustrated, she has to burden that responsibility. And the another thing that came up very time and again was that despite doing all the work throughout the day, their frustration and concern was that despite that, they are not able to do the caregiving that they used to or they feel they are responsible for. So that was really occupied their mental space a lot. The thing is that for many of these women, they don't have really the option of not going back as soon as the work was available, especially in the market when number of job opportunity were less and there was a lot of uncertainty. So it was actually them squeezing out that time from whatever time, little time that they had for sleeping, bathing, and whatever they were doing, and juggle between both the things like work and household responsibility, because the burden that they had, the expectation had also gone up, that now she's there, she should be taken care of. And people were not really keen, family members were not really keen on rolling back those expectation and responsibility. So that was how women were just juggling day in and out.
It's so important. And Sneha, you also aimed to understand more about the resilience strategies adopted by women to cope with all of these challenges. Can you tell us a bit more about that?
Yes, as Pranita also pointed out that our research is currently underway and we've just completed the formative. So within the formative also, this was implemented after the second wave of COVID in India, which was in April to June 2021. So what we saw was that the cohort that we are working with, street vendors and domestic workers in National Capital Region, and also other informal occupations. So we see that during the first wave or the first nationwide lockdown that happened in March 2020, a lot of these workers, to manage the economic fallout by themselves, so they depended on whatever meager savings that they had. So they depended on that. And they also went back to their villages in certain cases, since these are mostly migrants. But during the second wave, they didn't have that option, and they because it was not a nationwide lockdown, but the impact of that second wave was even more devastating in terms of the healthcare. So these workers, while they did not go back to their villages, they mostly depended, because also their savings were almost exhausted from the last phase. So they dependent on selling of assets, taking borrowing. So that was how they managed the economic fallout. But other than that, it is also important to highlight that most of these workers, they are largely absent in terms of the policy focus. So they already have an inner resilience built over period of years because of the persistent lack of focus from the state. So that was also one of the things that came in our research, that how state response or dependence on state response is largely non-existent for them. And they largely depend on community support or family support. And that's something that we also saw during this time. Like they would depend on their neighbors in terms of managing their childcare, or in terms of if they have to go and stand in rations or in queues for ration, so they would manage it with their neighbors in terms of how they can share responsibilities between each other. So that was also something. And then also the knowledge that there are other women who are going through a similar thing, that also helped them sail through a lot of this. And a few of our of the population that we worked during the formative, they were also part of a civil society organization, and they could also leverage on that kind of support during this period of time. So these were some of the strategies that they employed. And since I already mentioned that a primary research is currently underway, so we are also trying to explore it in more details in terms of how they were able to leverage some sort of support from their neighbors or from their family members and friends. But I'm also interested to hear from Anna if that's something, if it's something similar that you found in your study areas, and what kind of support did the workers get from there?
Thanks, Sneha. I think there are clear parallels between your findings and what we've seen in terms of informal workers' asset depletion strategies, such as borrowing money, drawing down savings, selling their assets, as you mentioned. And while we didn't find any significant gender differences in how men and women were coping, we can foresee how in the short and medium term, these strategies can have clear implications for how these informal workers are going to restart or reinvest in their businesses. And again, it's what Sneha said so sharply. We need to be mindful. These are workers who rely on their daily earnings to support themselves and their households. And another important finding from our interviews that connects with what Sneha said is that we heard that government relief measures were just unable to provide any long-standing relief to the crisis in 2021. So rather, we saw workers using any access to government relief to reduce one or more household pressures. So that included paying late electricity bills, late water bills, buying food staples, or even paying off some debt. But again, despite these devastating challenges and drops in income, I wanted to turn my attention to a bit of what we've learned about the comprehensive relief and support efforts provided by the worker organizations on the ground. And I thought I'd share some examples across the sectors that are in our study. So in mid-2021, we were able to map how street vendors and waste paper leaders in particular were focusing heavily on the promotion of occupational health and safety protocols, as well as measures to help secure these workers' ability and permission to work. Now, this in fact is crucial for worker organizations, especially as they were trying to counter the narratives of workers in public space as vectors of disease. And they were also pushing for long-held demands for decent and safe workplace infrastructure, including the need to support the costs of personal protective equipment. And we know that safe workplace infrastructure is important for women's physical and livelihood security. We also saw how domestic workers and home-based worker leaders, leading exclusively female membership-based organizations, provided support to address the psychological, material, and legal needs of their workers. So I think the story here is that while we've witnessed how women-led organizations have really relied on a logic of mutual care and solidarity, along with a very resilient and creative approach to claims-making strategies throughout the pandemic, these are worker organizations that are facing strains on being able to provide the same scope and depth of support, particularly in the absence of government responses and relief measures that are effectively targeting women's livelihood recovery across the different sectors.
And Ségolène, you also examined the effect of COVID-19 on the informal sector in Burkina Faso, and you found that as a resilience strategy, female entrepreneurs were less likely to lay off their employees. Could you tell us more about other resilience strategies adopted by women to cope with challenges?
Yes, in fact, more globally, to face the crisis, women-led enterprises have mostly adopted temporary closure of their businesses. That is mostly what they did at that time. So in turn, I have a question to Pranita. You find that there was an increase in violence during the pandemic in general. Can you share whether you found some heterogeneous effect or intersectionality?
Thanks. Yeah, so violence was especially for the groups with whom we did the study, which is the street vendors and domestic workers. Now, violence was always been part of their life, but then they could clearly articulate that during pandemic, it really increased of experience of violence, but even more the threat of violence. And that was in all the spaces in their domestic space, in the public spaces, and even the place of work. And they shared that how that has really affected them in different ways. So like for domestic workers specifically, they talked about the stigma and the harassment that they experienced from the housing societies where they were working, even from the employers. Interestingly, we also found that the women domestic workers who were doing part-time work, so the whole notion or the way they were stigmatized as the virus carrier. On the other hand, so there was some level of preference for live-in domestic workers, so that she's protected, and more than that, the employers are protected. But then there also women shared the experiences of violence, and given that they were not really able to connect with their own peers and their social network, somewhere it gave more opportunity for employers to behave the way they wanted without much of a control and pressure on them. So that really came out. For street vendors, they talked about violence experience from the state actors like police, municipal staff, both in terms of violence, direct violence, but also harassment, asking for bribes to even sit at the designated places where they were given. Another, when we are thinking about the vulnerability, single women, one was the work that they were involved, they were marginalized, and the pressure they were experiencing, but being single added to their vulnerabilities. And in fact, women shared some very horrifying and fearful experiences, that because of fear, they are not able to go out to use common toilets at night, or the co-vendors, the vendors, other peer vendors, how they harass them. So it became that there was a much more fight for the same small space, and being single, being woman and single, further enhanced her vulnerabilities. A lot of women who had migrated back to their villages, their experiences was almost similar. They were forced to spend time in quarantine centers, which were not really equipped to take care of them or to provide even some basic things. But even when they wanted to reach out to their homes, many women actually experienced harassment and violence from their neighbor, even from the families, and out of fear of infection, that they are coming back and maybe bringing all these virus. The saddest part still was for me, going through the study, is that violence is so much prevalent in the lives of these women, that even when they were saying that there is an increase in violence, they were bringing it, this is happening because this is happening, especially in the domestic space, that, my husband is so tensed, there's stress, this is bound to happen, this will happen. So even while they were more explicit in saying that there should be action from government and others in addressing the economic fallout, there was relatively less expression that, violence need to be addressed and not enough action and redressal mechanism is there. And that, internalizing and justifying some level is really something that you always make all of us sad, I suppose.
Yeah, it does. It does. And the way that it continues, in terms of we don't seem to be making much progress on that front. Now, time is our eternal enemy, because we could be spending an hour and a half just on each question that we've been looking at. But I am going to ask you, in terms of to looking forward, based on your research, in terms of documenting what you found and what's happened, but looking forward to what a more equitable and more inclusive recovery might look like. Geeta, what can you tell us about what local and national governments could be doing to support informal workers' livelihoods, particularly from a gender-sensitive perspective?
So I think, there's a lot that local and national government could be doing. So in the shorter term, so national and local government should meet workers' calls for ongoing immediate relief so that they can support their households. And that's mainly in the form of cash transfers or food support, and also vaccine access. And then government should also prioritize investment in workers' livelihoods by facilitating their access to grants, loans, business capital, among other measures. And then this could stimulate the national economy from the ground up, so from the workers up. But also local government should work on halting harassment towards informal workers through a do no harm principle, and should instead protect workers' access and right to work. And then in the longer term, social protection policies and schemes should respond to workers' demands for social security, health and childcare, paid leave, among other protections, while enacting and enforcing legal labor protections. And this is central to protecting and enabling workers' livelihoods.
It wouldn't be 2021 if there wasn't somebody on mute when they were supposed to be not on mute. Sigurlin, can you tell us a little bit about some of the recommendations for each of the 3 countries that your research focused on?
Okay, thank you. In Benin, we found that the policy used to contain the virus did not have a direct effect on intimate partner violence. However, households that were negatively economically affected experienced an increase in intimate partner violence. So the results suggest that policies aiming at to alleviate the financial constraint on household may have an added value on preventing intimate partner violence. In Burkina Faso, the study on informal sector revealed that men were more likely to experience loss in turnover and use layoff as a strategy to adapt to the crisis, while women were less likely to use this strategy. This suggests that a policy encouraging female entrepreneurship can help to reduce the negative employment effect of future crises. In many cases, the aid provided to support enterprise do not reach the informal sector for various reasons, corruption or favoritism, causing the absence of a clear definition and application of a criteria. This option has led to frustration that have sometimes caused social unrest. Such a situation may suggest promoting the development of a specific micro-insurance mechanism for informal activities by making a good categorization of them, as the informal sector is not uniform. And finally, the study in South Africa reports that the existing system was inadequate to meet the needs of the LGBTQ community. They experienced limited access to services such as the police and psychosocial support services. A policy aiming at improving the trust in the criminal justice system may help reducing the negative effect of future crises on LGBTQ community. So that's it.
That's very interesting. And Sneha, can I link this to your work? Sneha, what can you tell us about the priority areas that the government and CSOs should be focusing on to enable women workers to rebuild their lives and their livelihoods?
In terms of India's response to COVID, the government's response have largely remained on cash transfers and food subsidies, managing the economic fallout of COVID. While these were helpful, but they were not adequate in terms of the gravity of the situation that these women were in. But our research also points out to issues like mental health and violence as prominent areas of difficulties that these women faced. So in terms of mental health, there is no data or hardly any scheme or initiative that has been implemented by the government or any announcements made in those areas. So that remains a focus area that still needs to be addressed by the state. Even in terms of violence, while there were reports of increase in violence, and to address that kind of reports, there were several helpline numbers that were released during the lockdown period and after that. But what remains is that there is no data in terms of how were these helplines implemented, what kind of reports were there. So that's all. So the release of data around these also remains a focus area that should be addressed by the state. Even in terms of when there were several announcements around different issue areas, there were no follow-ups made by the state governments or the governments in terms of operational guidelines or financial commitments. So that also remains missing in the response to the issues for women workers. And in the few that were implemented during COVID, the policies that were implemented during COVID or the schemes that were implemented during COVID, they were largely built on existing governance structures. And all of these existing governance structures were already out of reach for women workers because of lack of documentation, lack of the digital divide that I talked about. So even the benefits that were available to them during pandemic, that remained hard for them to access. And this just shows how disconnected a lot of these policymakers remain to the need of women workers. And that's where the CSOs came in and filled in and tried to fill in that gap. So the focus of the civil society organizations across India remained on, helping women to gain access to identity cards or documentation, enrolling them in vaccination drives, and signing them up for state-sponsored social schemes and benefits, and also generating evidence. So that has largely been how the CSOs have tried to work during the pandemic and their response during that. So these were some of the areas that we thought are still that still need to be in terms of the focus area for the state, and how the CSOs have tried to fill in that gap.
It's really impressive from all of you in terms of the amount of data and evidence that you've been able to on a very short time frame in a rapidly evolving both political but also public health crisis, in terms of what you've been able to come up with, and the recommendations that you're coming up with are really pertinent and very impressive. Now, I promised you, audience, that we would make sure that we didn't talk for the whole time, and we've kept that promise. I would like to invite you to add questions in the chat box. Now, Jessica has also just put a note in to make sure that you're putting your questions in. Can you make sure that you include your name and the country that you're joining from? Because we like to see how international we are. And I'm just looking to see what the questions are that we could start with. Now, from Sonia Diaz, and I'm going to open this up to the whole panel. How have workers appropriated any of this knowledge that's been generated? Now, who would like to talk to that? Any of you? In terms of how workers have been able to use any of the research. Anna.
Sure. Thank you, Caroline, and thank you, Sonia, for that question. I think I'd just like to frame it that this was an opportunity for WeGo to connect with its partners and local researchers on the ground and really design the tools in close consultation with these organizations and researchers. And this was so important for us to avoid a truly extractive approach at a very sensitive moment where we knew that the workers were suffering. And so I just wanted to contextualize how that approach to research was important during the pandemic. And I think WeGo's approach to knowledge co-production with these close relationships of trust with our worker organizations on the ground and local researchers is also important for their own ownership of the data and to support their advocacy efforts. And I think that's speaking to what the question's all about. So if I can just give two examples of how the workers have used the data to influence local governments and even national governments, I think that's a powerful case for us to think about what's working, right? When we talk about research. So in the case of Plev in Bulgaria, our home-based worker leaders that are part of a trade union were able to communicate the drastic impacts of home-based workers in the city. And through that dialogue, the city municipality provided affordable space for them to sell their products. So I think this was a practical and fundamental response that local government came in to support home-based workers' livelihoods. And if we recall, Gita was saying that in our sample, that was really the sector that was hit the hardest. Then we also have, HomeNet Thailand and the Federation of Informal Workers in Thailand also pushing for policy dialogues to refer back to some of their long-held demands for social protection needs. And so I think these are clear examples of how workers have been making use of the data to push for, immediate relief, but also for long-standing demands, and just trying to keep pushing the pathways for dialogue.
Thank you. Now, I've got a question. I'm going to use my position as chair to ask you a question myself. I'm really interested to hear from any of you about the strategies that your teams used to conduct research during the pandemic. I mean, it was a situation without any precedents. you know, a global public health crisis like we have not seen in our generation. And the impact of that on how research is conducted, how the data is gathered. How did you cope with that? How did you cope with being able to conduct your research within the context of this global pandemic? I'm looking to see who I'm going to select. Anita, please.
Thank you. Thank you. No, it's a very important question, and I'll share some of experiences, what we have and the way we tried, and I'm sure there are other experiences here. I think even like, you know, what Anna said earlier, though in the response to other question, it was like, you know, the time of embedding the research within the community. So the idea of doing third-person assessment was definitely was really taken out from this whole idea of doing research. And that's where ICRW also planned this formative research. So before we get into the primary large-scale data collection, it was very important for us to understand with community what are the questions that what are the issues that they are experiencing, and how are they framing those questions, which not necessarily is the same way even as a researcher we often articulate. So that was like the starting point for us to have those discussion first was with the organizations who are working with them in the community, and with them being able to discuss with women who are experiencing these things on a daily basis, to spend time with them to understand their articulation, their experiences, the issues and challenges that they think are important. They think, and in a way with them to even frame the questions, the larger research questions, which are critical to inform the policy decisions and also program. And in that process, we also bring in representatives who have been working with unions, even academicians who have a very good understanding of this field, is to really inform our discussion and deliberation with the key people who we are saying that are respondent in this study. And this is going to be a loop that we learn from them, bring those back data to them to help us understand, to interpret, and then even taking the decision how those data can be used at what level. So advocacy is not necessarily only at the level of policy makers, but also like, you know, how trade unions can use those data, how the group of women, even an informal group, can use the data. And that also means that those data and the findings need to be articulated in a very different ways for the consumption of different stakeholders. So that's the way we are really looking at this.
And thinking about this, how the data and evidence is articulated, exactly as you said, for consumption of a different set audience. Gita, Segolen, Sneha, is there anything that you, in terms of how the research was conducted, how the research has been presented, how the research has been used, in terms of how you've adapted during the pandemic? Gita?
Yeah, I'm just gonna quickly say, to complement what Anna said, I think in the case of WeGo, because the research was in close collaboration with these member-based organizations who workers really trust and who can reach these workers, that facilitated our reach of workers. So now we could, even during the pandemic, where they were, as we saw in the data, they were having a hard time, they were really struggling. This relationship of trust between workers and their member and their organizations which we're working in made it easier for us to really hear honest reports from these workers and reach them and be able to incorporate them into our study. So I think this really close collaboration with member-based organization or with organization on the field is really important during a time of crisis, to be able to get better data and more reliable data. that could then be used to inform policy.
Yeah, thank you. Sneha.
So just, adding to what, our experience of doing research was very similar in terms of collaboration. So for our formative also, we collaborated with local organizations in the National Capital Region. And within that also, while we were doing a formative research, since that's the stage that we are at right now, that was really at the time where India was facing the hardest hit wave of COVID, which was the second wave of COVID around June 2021. So we were implementing or formative or planning or designing a formative during that time. So at that time, while the situation was still not safe enough to do in-person studies, so we also tried out, and because it was a formative, we also tried out an hybrid study where where it was very important for us to get voices from women workers. And we already understand that there is a digital divide from women workers, so it was not possible to do remote study with women workers. So we implemented a hybrid study where we did workshops in in-person mode with having representation from the partner organizations present in person during those workshops, while we had joined either through remote working, or we co-facilitated these sessions by training these partner organization staff. So that was also another level that we were able to approach the study. That worked for our formative, for our in-person study, for our primary research, where we are diving deeper into some of these questions that they raised during the formative. We felt that a hybrid study during this time will not work, because there are a lot of things that we want to know in greater detail. And that's why we waited a little bit longer time to be able to do an in-person primary research. So the way we approach this research has also been, COVID has really impacted how we are implementing the research as well. So a close collaboration and the way that we approach research has also changed during the pandemic.
Now, I've got another question that I would like to pose to any of you, which is, has any findings of your research surprised you? In other words, was there anything that you were not expecting has come up, or anything that you were expecting has not come up? To any of you. Ségolène, are you about to say something?
Oh, no, for the moment, just
Okay. Were there any findings that
Can't hear you, Caroline. But I heard the earlier time, like the question you had asked earlier, it surprises, something that we had not expected. But I think Sneha wanted to respond to that question.
I think Pranita, you might also be saying the same thing, but please do add on in that case. So one of the key things for us during the formative research was the articulation around mental health that these women spoke about. Again, since this was formative and we were trying to explore what are some of those issues, so we didn't go with an idea that we are going to explore about mental health and how they were coping with that, but the articulation and the continuous verbalization of how they were stressed, how they were tensed, how it was difficult for them to manage during this period, especially during how they were not being able to meet the loved ones at the last moment when the health impact was very devastating of COVID. So this kind of articulation that came in from women workers themselves directly, and also another aspect was for us to, which we are now trying to explore even further, is how the economic precarity also impacted the way that they were able to pose their agency or decision making within the household. So that kind of articulation also came from women workers, where when earlier they used to have earnings, whatever small amount of earnings they had a greater say in a lot of those decisions being taken within the household. So that articulation also came. So these were two key things that we are delving deep further when we are doing the primary research. But this was some of the things that not exactly surprises us, but also how much how lacking our articulation in terms of understanding these issues were. And this is something that we are still trying to find about further. But Pranita, if you wanted to add anything on this.
No, it's perfectly fine. Thank you.
Caroline, oh.
Anna, I think go ahead, as Caroline's sound seems to have deserted us briefly.
Okay, I just think, okay. I think I was just going to say that much of what we found didn't necessarily surprise us, but I think the level of stigmatization and harassment, as Pranita was also saying, especially on the onset of the pandemic, that I think was surprising for us in the sense that we immediately understood that it was important to discuss a do no harm principle for workers. And we saw that, in different spaces, as Pranita also said, domestic workers in their employers' homes, street vendors and waste pickers in public spaces. So I think there was an element there of what the pandemic did to exacerbate the level of violence that informal workers have historically already faced. I think from the unpaid care work data, it was striking to see how, by mid-2021, the story was so much on the costs of online homeschooling and that digital divide and the pressures that women were facing and how that was really impacting their ability to get back to work the same number of hours and impacting their earnings. So I think, again, it was how that kind of data from the beginning of the pandemic was holding true until the second round of our study. So I think it's really speaking to the inability for these workers to recover their livelihoods. So I think that's just something I wanted to add here, the dimension of their loss of livelihoods.
Thanks, Anna. I think given some sound challenges, I'm going to take over for a moment for Caroline. I believe there's a hand up from one of our attendees in the audience, Yerim Nam, and I think we can unmute you and allow you to ask your question directly, Yerim, if you're there, or you might have to unmute yourself. But if you're there, please go ahead and do ask your question. Your hands up.
Host has to do. I don't think the person can do. Host probably has to do it. Unmute her or him.
So Poppy, if you're able to unmute Yerim, please do go ahead. In the meantime, there was a question that came in asking to hear a little more about the recommendations around micro insurance. And if you can expand a little on those. I don't know if anybody wants to pick up on that. No takers. Okay, we'll come back to that one. And so Isabel would like to ask about challenges to measure the impacts in third world countries. In a lot of cases, we face the challenges towards measuring how big the problem is and the quality of the data made available by governments. Is there an alternative path we can take to dimension the magnitude of differentiated impacts in a context like ours? And that's a question from Guatemala. Big question. Any thoughts on that from the panel?
Just wanted to briefly share about the data that government shares. Now, ICRW is doing a sex desegregated data, tracking of sex desegregated data on clinical outcomes and across 200 plus countries with other partners, GS 5050 and others. The big issue is that the lack of data availability from major countries. So one is that those data are not regularly available. The second is that whatever is available, those are actually presenting some very interesting finding as how gender norms in different contexts make even women and men vulnerable, more or less vulnerable to infection. And in terms of like testing, hospitalization, deaths, infection, or on all those track. But given that there's and those are very important and necessary data to inform the policy making, but unfortunately, those are not really available and in the public domain. And that also poses a question as to why such important data is still not available despite some common agreement way back on sharing and making such data available. And then that really also puts a lot of question and barriers in terms of having policies which are much more gender specific and responsive in a given population. So that is definitely a big issue. Measurement is definitely, and I think Anna and I think Gida talked about earlier, that this is really very sensitive time, and there is a lot of trust is needed during data collection to make data quality appropriate. So the role of civil society organization or just the partner organization become extremely crucial to have a better quality data at this stage. But I think as we move forward, maybe we'll also have more to share in terms of the actual measurement, which we may not have like from ICRW as of now.
Oh, thank you, Pranita. Gida, you look like you were nodding along to that. Did you want to come in and join into what Pranita was saying around the data?
Yeah, definitely. I want to complement this by saying that, so in order to ensure the quality of the data, again, working with like workers' organization for us was really key, because as we would get the data, we would go over it like very closely. And when we would note, like trends that didn't really seem very reasonable or things that were slightly questionable, then we could directly reach these workers' organization, and they can reach the workers, or they often understand themselves what's happening. And they can tell us like, oh, maybe there's an issue here that we could fix in the data, or they could explain to us why we're seeing these trends. And this really helps us improve the quality of the data and then trust it more. And then something else that also I want to add is complementing the quantitative data that we're getting by qualitative data, so by interviews. Because when we also had like these interviews, it was also easier for us to, when we're seeing trends in the data, and then we're seeing that in the interviews, workers were also talking about this, that also made us feel more comfortable and understand better what we were seeing in the data. So I think also this mixed method, quant-qual, also helps improve and trust more the data that we're getting.
Thanks, Gida. Anna, your hand's also up. I'll let you come in and add to that.
I just wanted to say that the points that Pranita and Gita were making are important for us to think about questions that were sensitive, and that we needed the feedback as well for our local teams, our local researchers, to provide that contextual based sensitivity of what would work and what wouldn't work. So that was essential during the piloting of our survey. And as Gita rightfully said, we've also had extensive moments of really making sense of the data with the teams, and the teams making sense of the data with the workers and the worker organizations. So that's also another important step in their own validation and ownership of the data. So I just wanted to bring in that there are multiple stages and steps that help ensure the validity of the data itself, right? And especially in such a delicate moment of really having to do research over the phone and all of the other difficult moments that workers and our research teams were also facing by listening to these difficult stories.
Thanks, Anna. Pranita, did you want to add on to that?
Yeah, I'll just take just 1 minute.
Mhm.
I think that there is also need to make all data, like even what we are collecting at certain time publicly available, de-identified data, so that a better cross-country analysis and interpretation can be done. And there could be many ways in which a data set can be analyzed. So the way people had really pulled in data on, like, clinical data, I think we really also need to bring out more and more data, make it in a public domain, even the social data that are being collected by us, but many other organizations. So I just wanted to share that.
Thank you, Pranita. I'm going to move on. I had a question that came in for Segolene at African School of Economics around the rationale for choosing the 3 countries that you're working in. Segolene.
Yes, thank you. In fact, we could see that Benin and Burkina Faso and South Africa have a different background, different context. And why we choose these 3 countries, because we want to analyze to see how the COVID have affected the impact of COVID-19 in this high country with high crime. We see that Burkina Faso high level of crime, also South Africa. So we want to see the comparison between Benin, who has relatively low level of crime. And this also, we could see the difference while we were collecting data, the difficulties that arrived on the feed. There were slightly less difficulties here in Benin. The only difficulties is people who don't have a lot of time to spend while we are running the interviews. And for instance, in Burkina Faso, also it was also difficult to reach people for interview, but to adapt to the schedule. But they tried to do it. And because it was the informal sector and people are striving, finding the means. And also now, it is South Africa which encountered many difficulties while conducting their survey because of the situation of insecurity or the hard lockdown. These are bad conditions. So finding the availability of participants was very difficulties. We should align with the schedule. People should also be working, and you came for interview, so you should wait. You should adapt to the schedule and come back. So these are the difficulties that they encounter during the field data collection. So some are the many specific things that I could say the different thing between the 3 countries.
Thank you, Segolene. I think what we're hearing on the challenges is something that we've been hearing across, all of the research programs that we work with during the pandemic, but excellent to hear more about your 3 countries in particular. I'm going to ask one final question that came in for anybody or all of the projects, but thinking about what do you think are the next steps for your research? Where does it go from here? Obviously, things are still evolving. We're moving into a kind of new normal and living with COVID. What do you think would be the logical next step for each of your projects?
Me?
Sure, Segolene, go ahead.
Okay. But now, currently, in Benin, we are going to show the analysis of the data collected, but we pursue a second phase in Burkina Faso as well as in South Africa. This is now, South Africa will conduct a second round of the survey, which is quantitative. And in Burkina Faso also, they will conduct a second round of survey. So these are the next step now, and we will make after an analysis of the three findings, the three data that were collected. So that are the next steps.
Thanks, Segaline. Would anybody else like to speak from either of the other projects, WIEGO or ICRW? Sneha.
So in terms of project, this project is also currently going on in Uganda and Kenya. So they are also in the similar phase where they are implementing primary research, which includes a quantitative survey and a qualitative component as well. So the three countries are currently in terms of the project phases, we are currently underway. So in terms of the logical next step is that at the end of the data collection and at the end of the analysis, we would be developing country level reports in terms of recommendations for gender responsive recovery, but also a larger global, looking at what kind of alignments are there in terms of findings. We'll also be developing a global recommendation for gender responsive recovery. And other than that, we are also looking at advocacy at different levels, as Pranita said, that, advocacy at a level with grassroots organizations that are working with some of these implementation structures of the policies, like municipal governments or local governance structures within national capital regions. So that kind of advocacy, and of course an advocacy at a larger level with policymakers. So that's something that we are planning on in terms of the next steps of the project.
Thank you, Sneha. Anna or Gita, did you want to respond to that? Or if not, we'll move on to our final kind of takeaway points, but just an opportunity if you wanted to talk about next steps.
Sure, I think it's very much in common with the next steps Sneha has just laid out. We had city fact sheets for all of our 12 cities for round 1 and round 2. We're just finalizing a global report now. And I think it's really about supporting the local teams and worker organizations and how they can push forward through policy dialogues, but also making visible their needs at this stage. So with multiple stakeholders, whether it's the media or other local allies, and really trying to land this in other important global advocacy spaces as well.
Thanks, Anna, which leads me on to our last sort of 5 or 6 minutes. It would be great to hear from each of our panelists your kind of key take-home point from this whole discussion. So what's really stood out, or what's the kind of one thing that you really want to drive home from today and from your research? Gita, can I start with you?
Yeah, sure. So I think for us, so the attention to the political demands of informal workers, so we realize that the attention to political demands of informal workers can really help reframe informal women workers as the primary vehicle and metric of successful COVID-19 recovery, rather than just a trickle-down recipient of aid or policies. And also, as we spoke a lot about, the knowledge and ability to reach informal workers have been central to member-based organization, and we believe that this really holds important lessons for government.
Wonderfully succinct. Thanks, Gita. Anna, I'll move to you and stick with WIEGO, and then we'll move on to Segaline. But yeah, your kind of key take-home point.
Okay, thanks, Jessica. So I think from what we're hearing, there's an opportunity at hand for policymakers to really begin committing to dialogue and collaboration, whether it's with women informal workers in general, or other vulnerable groups. And I think it's important for them to think about the value in co-producing practical solutions that will ultimately tackle the structural inequalities that the pandemic has only exacerbated. So this kind of response would actually address the negative economic impacts of the pandemic, mitigate against future shocks and crises, but really importantly, bring women's voices and demands and knowledge to key decision-making settings. So I think it's really about understanding how recognition and responsiveness of governments can be understood as principles of fairness that that reorient or reshape the relationship between informal workers and local governments. And I thought it would be fitting to end my takeaway by honoring the voice and demand from one of the workers we interviewed. And this demand was poignantly expressed by a woman waste picker leader from Accra when she said the following: "We realize the importance of our work to the community, and it's very painful for us. Now that we know that the work we are doing benefits the government and the community, and they don't see us playing any role, are we not a part of them? Are we not a part of the country? Are we not citizens?" So on behalf of WeGo, I just wanted to express my gratitude for the knowledge, time, and trust of the worker organizations, the workers, the worker leaders, and our local research teams who partnered with us in the study.
Thank you, Anna, and thank you for bringing that voice at the end. That's really powerful. Can I move on? Ségolène, it would be great to hear your final point. If you're still there, your camera seems to have gone. Hopefully we can still hear you.
Yes, thank you. What we could get from our study is that both biological sex and sexual orientation have people have both experienced an impact due to COVID-19, due to this category of people. So people have been affected economically, as we see as with the result from Benin and Burkina Faso. So if financial constraint could be alleviated for people in these countries, this will help more, while during a crisis like COVID-19 to be more resilient. So that's somehow.
Thank you, Ségolène. And Sneha, I'll come to you, and then Pranita will finish. But Sneha, what's your key take-home message?
I think one of the key take-home message is that how largely similar the issues for informal workers and workers have been across the context, and how gender-blind policies have been implemented by different state governments, and without accounting for some of the inequalities that these workers already face, and what kind of unintended consequences that these policies could have. Another point is that how the informal workers have largely been ignored in the policy making and policy formulation, especially the urban informal workers, especially in the case of India. And the policymakers have largely remained disconnected from the needs of these workers. So those are some key findings, and there is a need for us to right now recognize and identify some of these immediate needs of the workers, and also reimagine a longer recovery path which is gender transformative and gender responsive to their needs.
Thank you, Sneha. And finally, last but not least, Pranita.
Thank you. And I really agree with all the points already said. And every time I have this conversation, my resolve towards the feeling that, with all the devastation that pandemic has brought in, it also has given us an opportunity to reimagine the whole policy and program framing processes. The thing is that the women in informal economies cannot just be the passive recipient of government program, passive recipients of their entitlements. They must be kept on the table to be a critical decision maker in the whole process. Otherwise, it will just be two parallel process where there are certain policy decisions while the needs may be entirely different for women with least convergence. So they have to be on the table. Their voice must be recognized and incorporated in framing of policies and programming. And I feel we can't delay that further. I mean, we have already lost too much of time, but we have to have them in the decision making. There has to be a shared power in these processes. It cannot just be someone making program and policies for someone else.
Thank you, Pranita. I really love that framing of seeing the pandemic as an opportunity, as really, you know, blowing the lid on issues that are not new, have been around for, you know, for a very, very long time, but possibly giving us the opportunity to really shine a light on it, break down some of the barriers, open up, you know, the data disconnect and start moving forward. I'm going to wrap it up there. I would really like to thank all of our panelists. It's been incredible. I mean, I've worked with you all on the research for some time, but to hear you voice it, you know, in your own words and tell us more and getting to the nuance of what you've been doing and think about where the recommendations need to go next has been excellent. We've had some really nice comments in the chat from participants who've really enjoyed it too. So thank you. You've worked really hard. Thank you to Caroline and colleagues at IDRC for hosting and for funding this excellent research. And thank you to all colleagues at IDS for making this webinar happen. And finally, thank you to everybody who attended. I hope you enjoyed the session. If you would like to know more, please do visit the website c19re.org, which is in the chat. There are so many resources in there, signposts to all the different projects that we've covered today and many more. And we will be sharing the recording of this session in a few days on the website. So if you want to rewatch it, or if you want to share it with colleagues who couldn't attend, then please do so. And on that note, I'm going to say thank you to everybody and we're going to wrap up. So thank you all.
Thank you. Thanks, everyone. Bye.
Thank you, everyone.
Thank you.